My dear viewers, we have Dr. Sridevi with us. Doctor, one of the very common issues in a woman is a urinary tract infection. Can you share about urinary tract infection, please?
Sure, thank you. So what is this urinary tract infection? So what consists of the urinary tract? That is it starts with the kidney, the ureter, the bladder and the urethra. So commonly the urethra and the bladder, we call it as lower urinary tract. So that is what is UTI. When we say UTI, we mean a lower urinary tract infection. So in a lower urinary tract infection, why is it common? It is very, very common in women. Why is it common is because it has a short urethra, so the chance of infection is more. And also, when all can a woman experience this kind UTI is following sexual intercourse, or sometimes when they don't drink a lot of water, or when they try to avoid because you're in a public place and you don't want to pass urine, so when you have retention of urine. So these type of reasons makes it very common in women. And also when you have diabetes mellitus, so those type of, or when your immunity is low, then you tend to have more chance of urinary tract infection. So usually what will be the complaints? So what will the patient have? The patient will have a sense to urinate, and it has to be immediate, urge to urinate. They have to pass urine immediately. They will have a burning sensation or some tingling sensation, and sometimes they will have difficulty in passing urine, or they can have a painful urination. And sometimes there may be blood along with the urine. It may be blood tinged, that is, it may have a red color, or it may be a frank blood passed in the urine. Also, they will have some abdominal pain, lower abdominal pain. And some people may have associated back pain along with this. And if it is very severe, since it's an infection, they may also have fever with chills and rigor. So this is some of the few common symptoms which they in urinary tract infection. Why is this urinary tract infection important? It has to be identified correctly and it has to be treated immediately. Once you don't treat it, a lower urinary tract infection can become an upper urinary tract infection. Like I told you, it passes through the ureter and it may go to the kidney. Once it goes to the kidney, we call that as pyelonephritis, which is quite dangerous. Then you have to get admitted in the hospital, and only intravenous antibiotics can cure you, and the duration of treatment is much longer. So we don't want those types of complications. So when it's a urinary tract infection itself, that is in a beginning stage itself, lower tract itself, if we treat it, then we can give you an oral drug which can cure the symptoms and you can get much better. So other than drugs, what can be done to avoid these kind of infections? You should have plenty of water. Since water is the treatment, what happens is, even if there's mild infection, your water you drink clears off, as you will be passing more urine. So it just clears off the urinary tract. And also cranberry juice, if you drink, that helps in the passage of urine. And you should not have, and following intercourse, you should maintain proper hygiene, and following menstruation, you should maintain proper hygiene. And when you're using a common bathroom, that time also you have to be more careful, and it's better not to avoid, you should not have any retention of urine. When you have the urge to pass urine, it should be passed immediately, because constantly over a period of time you keep retention of urine, then that also becomes a problem. So these are the various complications, and urinary tract infection has to be identified correctly. And the treatment can be with general treatment, like antibiotics can be given. And before that, if preferable, you can send a urine for urine culture sensitivity. So you don't give any antibiotic, you just give what is sensitive, whether it really needs, whether the amount, you can know the amount of infection and what that infection, what is sensitive, to which antibiotic that is sensitive. For example, like gram-negative, we say E. coli, like that means depending on that, the treatment can be given, which is sensitive to that organism, and the amount of infection also. So the amount of infection, we will know whether to start on a lower antibiotic, or it requires a higher antibiotic, or whether we have to give it intravenously for 5 or 7 days. Sometimes you may require, usually we give it for 5 to 7 days. Sometimes it may require a higher dosage and a longer duration to prevent this pyelonephritis. So because of that, we have to know about a urinary tract infection. This is also very common in pregnancy also. In pregnancy, sometimes there wouldn't be any symptoms, but still when you take a urine test and see, then you call that as asymptomatic bacteriuria. So that also has to be addressed and it has to be treated. Why we need to treat that is when it goes into like there's a constant infection, it starts irritating the uterus. So once it starts irritating the uterus, you can go into preterm labor. What is preterm labor? Is before 37 weeks itself, when your body is still not, when the baby is still not ready to come out, before that itself you can deliver. So it has to be identified correctly and treated at the proper time.
Yeah, I think it's beautifully said. Very nice. It's a preterm labor and it has to be treated depending on the sensitivity. Before that, they can do a simple urine examination to see any pus cells, any kind of protein, RBCs, all that. It can be seen in a simple urine. And after culture sensitivity, properly you will be knowing. And anyway, it's a great learning and really thank Dr. Sridevi. Thank you.
Thank you.